As far as who to test, that list keeps growing and growing. Any age having a family history of ovarian cancer, pancreatic cancer, or metastatic prostate cancer. The type of testing that we offer is different than what you would find as, they call it direct to consumer, where you take the test online or order it yourself to be done at home. So I always recommend the clinical test and with a genetic counselor. There's a few possible results. You can have a result that is positive, where a gene is found and it's known to be pathogenic or disease causing. You can have a result that's of uncertain significance, and then you can have a result that's negative. If you end up in the uncertain significance, this just means that we don't know enough about this gene to say whether it is going to cause a disease or if it's just something that runs in your family and makes you unique. About 90% of those uncertain results turn out to be benign or not cancer causing and just something in your family tree. Negative means that none of those genes that we tested for were identified. You may still be eligible for extra screening with MRIs of the breast or to use a medication to reduce your risk of breast cancer. The good thing about having the testing here is that the genetic counselors are well versed in, even with a negative result, they'll still run those additional risk models that are appropriate. And if you're at high risk because of a genetic test positive or because it was negative but with a high risk model, you'll end up meeting myself or Kathleen Goff, and we'll help you understand, well, how do you incorporate into all of this into your overall health? What should you be doing from a screening standpoint? Is it the same as the average person? And what can you do from a lifestyle standpoint as well to reduce your risk of cancer?